Computed tomography, also known as CT scan or CAT scan, is a powerful medical imaging technique that provides detailed cross-sectional images of the body's internal structures. CT works on the principle of X-ray imaging. It uses a rotating X-ray machine and a computer to create detailed cross-sectional images of the body. Unlike traditional X-rays, which produce 2D images, CT scans generate 3D images. During a CT scan, the patient lies on a table that moves through a donut-shaped machine called a CT scanner that lasts about 15 to 30 minutes to complete if a contrast is used. X-ray beams are directed through the body from multiple angles, and detectors on the opposite side measure the amount of radiation that passes through the tissues. This data is then processed by a computer to create cross-sectional images or slices. In some cases, a contrast dye may be used to enhance the visibility of certain structures, such as blood vessels or organs. This is often administered orally or through an IV and usually leaves the body after 24 hours. CT scans are widely used in medicine for various purposes, such as making diagnosis, planning, monitoring, and emergency medicine. Diagnosis is crucial for detecting and diagnosing conditions like fractures, tumors, infections, and internal bleeding. CT scans are essential for planning surgeries and radiation therapy by providing detailed information about the size and location of abnormalities. Doctors use CT scans to monitor the progress of treatments, such as cancer therapy, by comparing scans taken at different times. In emergency situations, CT scans can quickly assess injuries to the head, chest, abdomen, and pelvis, aiding in swift medical decisions. On October 1, 1971, Dr. Ambrose observed the first CT scan of a live patient, but it took him 2 days to view the images since they had to be reconstructed on an off-site time-shared mainframe computer. While CT scans are highly valuable, they involve exposure to ionizing radiation. The radiation dose is typically kept as low as possible to minimize risks, and the benefits of accurate diagnosis usually outweigh the potential risks from radiation exposure. CT can also be used to perform a non-invasive procedure known as a virtual colonoscopy or CT colonography. Instead of traditional colonoscopy, which involves inserting a long tube into the colon, virtual colonoscopy uses CT scans to create detailed 3D images of the colon. It's a valuable tool for detecting colorectal polyps and cancer, offering a less invasive option for patients. CT technology has evolved over the years. Multi-slice or multi-detector scanners are now common, allowing for faster imaging and providing a more improved image quality. In summary, computed tomography, which utilizes X-rays and computer processing to produce accurate cross-sectional images of the body, is an essential medical imaging technology. With continual developments aimed at developing its safety and capabilities, it plays a critical role in diagnosing and monitoring a variety of medical disorders to eventually aid in making patients feel better overall and diagnose the proper conditions necessary.